Edarbi is a prescription medicine used to treat the symptoms of high blood pressure, hypertension. Edarbi may be used alone or with other medications. Edarbi belongs to a class of drugs called angiotensin II receptor blocker. Indications. Edarbi is indicated for the treatment of essential hypertension in adults. How to use. The recommended starting dose in adults is 40 mg once daily. The dose may be increased to a maximum of 80 mg once daily for patients whose blood pressure is not adequately controlled at the lower dose. Near maximal antihypertensive effect is evident at 2 weeks, with maximal effects attained by 4 weeks. If blood pressure is not adequately controlled with Edarbi alone, additional blood pressure reduction can be achieved when this treatment is co-administered with other antihypertensive medicinal products, including diuretics, such as chlortalidone and hydrochlorothiazide, and calcium channel blockers. Contraindications. Hypersensitivity to the active substance or to any of the excipients. Second and third trimester of pregnancy. The concomitant use of Edarbi with aliskiren-containing products is contraindicated in patients with diabetes mellitus or renal impairment. Precautions. Before taking isolsartan, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell a doctor or pharmacist your medical history, especially of dehydration, high level of potassium in the blood. Edarbi side effects. Get emergency medical help if you have signs of an allergic reaction to Edarbi, hives, difficult breathing, swelling of your face, lips, tongue, throat. Call a doctor at once if you have little or no urination, or a lightheaded feeling like you might pass out. Common Edarbi side effects may include diarrhea,